Hello everyone and welcome. Welcome to Pink Lady Presents, a show filled with people who are living their lives well right now, from every walk of life, every ethnicity, and every age. So hello there, and today is no different. Today we have someone who is definitely living his life well lived for other people, Dr. Stephen Braverman. Good morning.
Hi, good morning.
I tell people that the people, when they said, you do lives well lived, I said, well, no, we don't want lived. We want people who are living their lives doing it well. You were in the Army for how many years?
Well, officially 29 years and 4 months.
Wow.
So that doesn't include some of the reserve time while I was in medical school and then the training. But yeah, for a while. A good period of time.
Why Army?
Well, originally I got into the Army because it was a method to pay for medical school. And in fact, the same day I got my acceptance letter to Vanderbilt, back in those days you actually got mail, and to medical school for Vanderbilt, I also got a recruitment letter from the Army recruiters saying, we can help you pay for your scholarship since you got into Vanderbilt. And the good thing is, I guess I opened my Vanderbilt letter first. Otherwise, I would have found out by opening the recruiter letter that I had gotten into Vanderbilt. But it was an opportunity to pay for school, and I thought that it would fit, the kinds of things that were important to me, like service, but also the dedication, responsibility, and methods to kind of take care of things, and I guess the way in which people just served, the responsibility and all of that eventually meshed along the way.
Why rehab type doctor? I mean, well, why that type of medicine?
So physical medicine and rehabilitation runs the gamut from musculoskeletal medicine and sports medicine all the way through rehab of amputees, spinal cord injuries, and that sort of thing. So I originally, when I went into medical school, thought I'd be an orthopedist.
Oh, really?
But I found out that I liked the clinic stuff better than I liked, the OR. And you can't be an orthopedist if you don't like the OR.
Correct,
so, it drew me to the musculoskeletal aspect of care, and then I got engaged with the rehab part. And it was a way for our patients, whether it was taking care of people with chronic pain, taking care of people with head injuries or amputations, strokes, to be able to further their ability to take care of themselves and to function. And
in addition to being the director of the Greater Los Angeles healthcare system, I know there's a magnificent program at Tibor-Rubin down in Long Beach for rehabilitative medicine as well. A lot of equipment that's state-of-the-art so that our servicemen and women will get the best possible ability to rehabilitate.
Yeah, our spinal cord injury inpatient rehab for the region is down there.
You also served, and I want to thank you for your service, in Iraq, 2008, 2009. What was that like, Doctor?
Well, my role when I was in Iraq was to be the chief of the clinical operations that were ongoing out there.
Wow.
So most of my time was spent in Camp Victory, which was the headquarters for the multinational corps.
Okay.
Occasionally went outside and visited other places. I recall one episode where we went to the Ministry of Health hospital in Baghdad. That was a little bit of a surreal experience because...
In what way?
Well, we had a few of us from the U.S. government. My boss, General Caravallo, and I were there visiting to talk about healthcare in the community there in Baghdad. But for us to go into that environment, we had a group of security military members, and we were all in our battle gear and everything else, but yet we're walking through this hospital where Iraqi citizens were just like you and I are now, going through and getting their health care, and then here's this group of Americans with their uniform and their Kevlar and their
right.
weapons walking through to make sure that we were safe while we were
in a way,
seeing
it's
some of
frightening
those.
too.
Well, we were the first Americans in about 4 years to go into that hospital because it had been so dangerous before.
Who was the greatest influence in your career? And why?
So I don't know if I could pinpoint one person. I think we learned from a lot.
Yes.
But one funny story, and one that I relate sometimes, I was the residency program director for physical medicine and rehab, and also the PM&R service chief at Walter Reed. And probably late in 1998 or so, I was a major getting ready to get promoted soon to lieutenant colonel, and I got a summons from then Brigadier General Cussman to come to his office. He was the commander of the hospital. So, of course, the first thing you think about is, what did I do wrong? But then I figured, well, if I had done something wrong, I probably would have heard from my boss, the deputy commander. So I went up to his office, and he had me sit on his couch, and he pulls out this manila envelope and pulls out a picture from that, and I was Mr. February in the Jewish War Veterans fundraising calendar.
Wow.
Now, I was in full uniform, so
I love
it's
it.
not what you think. But his mother had gotten that calendar and said, hey, you got a nice-looking guy at your hospital. Can you get him to sign this picture?
Oh, I love it.
So that was the introduction, though, to about a 20-minute kind of mentoring session where General Cussman said, what do you want to do with your career as you move forward? And you're pretty good at what you do.
Right.
Can I help you discuss that? And what he said that I still remember today and tell to many others is, you don't want to look back on your 20-year or whatever career and say, I wish I had, because you can.
Right.
You can always go and try new things, and if it doesn't work out, go back to being a clinician and an academician, which I was at the time. So that kind of pushed me on to the operational command side of hospital operations in the Army, and then went on to be a deputy commander, a hospital commander, lab commander a few different times. So it was a kind of a permission to do those different things. So I thought that was important.
Why join the Veterans Administration? You were a doctor. You could have gone anywhere, right? Why did you feel that your work, you would be satisfied with what you were going to be doing and to make a difference? Why the Veterans Administration?
Well, so I think there were professional as well as personal reasons.
Okay.
When I finished the Army, knew I was going to retire, one of the things that I wanted to do was to figure out what I liked about being in the Army. And probably the jobs that I liked the most was when I was a hospital commander at Fort Hood and Fort Knox.
Okay.
So I wanted to search to be a CEO of a hospital somewhere. And because of my background, a lot of civilian hospitals didn't want anything to do with me because I maybe not have been an expert in their fundraising processes and all of that kind of stuff, but I knew an awful lot about federal health care. And so that was a natural fit in the VA.
Right.
And because of my leadership, that kind of set me apart from some others because of the development that you get through in the Army. So then add to that the ability to get a job as a hospital director at the time. I went to the Edward Hines Jr. VA Hospital in Chicago as my first job in the VA. There's also that ability to continue to serve. My wife has been with me. We've been married 35 years, so
love it.
This is we have our 15th house now. Over that period of time because we moved a bit. The family's gone with us. My daughter was in the Army. My son-in-law was in the Army. My second daughter, that was my oldest. My second daughter is an Army physician.
Oh wow!
My third daughter went to college on an acting degree, so if she ever put on the uniform, it wasn't going to be in the service. But the ability to continue to serve and to actually add credibility to the position as a hospital and medical center director, because I served also, makes it easier to do my job.
Right, and you came to our facility in 2019, I believe it was.
That's right. It's just been a little more than 2 years now.
Right, I think that, we're blessed. We're most fortunate.
Two things happened because one of the first programs you attended was when we opened the columbarium at the
Right.
National Cemetery. And the other thing that I can thank you for, and you can share it with the others, when I needed serious surgery, I served during Vietnam for 6 years, and they found out that I had to have heart surgery. And my VA doctor told me exactly what was going to happen. He said, live or die, try this one first. And we did, and that was 20 years ago. So the VA has more than once saved my life.
Right.
And on behalf of all the doctors who have helped me and the nurses and staff, we thank you so that you can share that with them the next time you're talking to them.
And we will be right back.
It's about the humans. These humans, those humans, Grooven and Golden. It's about getting more than health insurance and a partner who listens and acts. Humana calls it human care. It's talking to a doctor from your couch or helping you find a cheaper prescription before you ask. It's helping you fix the rugs so you don't fall and keeping you social, online or off. It's getting to know you so you can be your healthiest. That's our superpower. That's human care from Humana.
I know, Doctor, that you have and I know you're proud of the hospital here in West LA. Tell me, it is one of the largest ones, right?
Yes.
In the country. And also, how many patients can your hospital actually take in hospital? How many beds?
Well, we have a little over 700
Oh, wow.
when we include both the acute inpatient care as well as our nursing homes. We also have a couple of nursing homes in the Sepulveda campus, the ambulatory care center in the North Hills, San Fernando Valley area. And then we have 2 buildings that house domiciliary residents. Those
yes.
are outpatient residential treatment for substance use disorders, mental health, and homelessness.
Wow. What about in and out patients? They come in for a day or just taking
we
care of
serve
them?
about 90,000 veterans. So in addition to our medical center in West LA, we have 2 ambulatory care centers in Los Angeles and the Sepulveda one I mentioned, and then 8 community-based outpatient clinics that go from Oxnard up to San Luis Obispo, and then East Los Angeles up through San Gabriel Valley all the way up to
And those are all yours?
They're all ours.
I love it. I think that keeps you busy. The next thing is what's going to keep you busy for quite a few years is I understand that you have major construction going on. Do tell us about that.
Well, there's a couple of different phases of the construction. So one on the south part of our campus where the majority of our healthcare services reside, we have a new kitchen going up.
Oh.
We're getting prepared to finalize a new critical care tower that will be modernizing our inpatient hospital and OR systems.
Okay, when you say critical care section, I mean...
So the critical care tower means that would include the inpatient care, the ICUs, and the surgical suites and the emergency departments.
Wow.
So all of those require critical functions, and our current hospital has some vulnerabilities with earthquakes where some of that could be knocked out. So
how old is it? Is it 40-something or 50-something?
1976.
1976.
So I guess we can do the math. What's that, 45 years?
Wow.
Or something like that. So it's in pretty good shape, but the elevators and some of the hard wiring, could potentially be vulnerable to earthquake.
So what are you thinking of taking that hospital eventually and gutting it and then building a new one?
Well, so we'll build the new critical care tower, and then we'll fix some of those vulnerabilities in the bigger one, but use that primarily for outpatient care and other kind of services.
And one of the things that we get to do is every Christmas Day since 1946, the Jewish war veterans and our brothers and sisters of the American Legion and other groups come in and say thank you to every inpatient and bring them a gift on Christmas morning. As our way of just recognizing their service.
Right. Now, during COVID, we added the capability for 90 additional beds.
Oh, really? Wow.
Both acute and ICU beds. We didn't need that much. I think we peaked at one point in the fall-winter surge from last year at 52 inpatients.
But at least you had all that ready for them.
Capability, yes.
Wow. Your stewardship of the greater Los Angeles healthcare system since you've been there has been, from what I understand from everybody, phenomenal, because your ideas are so well thought of and focused for our veterans there. We have a COVID pandemic. What things did you do when it first hit our state here?
Well, in addition to the surge expansion that we
Right.
put into place in building negative pressure
Right.
rooms and that sort of thing, one of the things that I'm proud of is that throughout the pandemic we've been trying to follow the science and
Okay.
not letting political views get in the way of what we thought was the right thing to do. So we were the first hospital within the VA, as far as we can tell, to do testing, mandatory testing for asymptomatic people in our nursing homes.
Oh.
And in fact, that episode,
Wow.
we had 2 positive COVID veterans in one of our nursing homes in early March.
Right.
Then we tested everybody and found 14 asymptomatic
Oh, my goodness.
veterans. And by doing that and then segregating them out, they didn't need hospital care, but we
Right.
built what we called a COVID recovery unit, a nursing home area exclusive to everyone else for people who were COVID positive.
That was
we were
great.
actually able
Yeah.
to prevent a bad outbreak. One of our veterans unfortunately passed away out of the 21 that ended up being positive, but it didn't spread to everyone.
To everybody.
And that got published in Morbidity and Mortality Weekly Review, CDC's journal, in May of 2020.
Oh, my
and
goodness.
then the Journal of American Geriatric Society about the CRU, COVID Recovery Unit, in October of 2020. So one of the things that I'm proud of with our hospital is that we have what I would call an academic culture. We want to innovate, we want to research problems, and then we want to publish our success or non-success, lack of success, in the medical literature so we can share that information, and we have a good record of that.
Part and parcel of that, and again, I get the opportunity to thank you on behalf of thousands of people. We came to you and you assigned Sally Hemmett from the social service program, and we have served now over 650,000 free meals to veterans, seniors, and food insecure, because you said, let's do this. And we can never thank you enough, and all of those people have been receiving meals since COVID started. Can't thank you enough.
Yeah,
So,
I'm glad you mentioned Sally Hammett. She's a superstar as our chief of social worker. We got her from Cleveland, so we're really happy to
Thank
get
goodness
her.
for that, right?
But as an example, we were also the only VA hospital that was a phase 3 trial site for the Moderna vaccine. And it was for veterans, so I became a subject, a test subject for the vaccine. I actually got vaccinated back in September and October of 2020 as one of the research subjects.
I would like our audience now to see a video about some of your master plan. Let's go to it now.
Good afternoon, everyone. I'm Mac McHenrick, the Executive Director for our Community Engagement Reintegration Service, SERS, and our Strategic Facility and Master Planning Office. I wanted to welcome you to the Greater Los Angeles Healthcare System, where we have a little over 388 acres of land at our West LA campus, and we also have 10 other sites of care, 2 ambulatory care centers, and a whole bunch of CBOCs all the way up to San Luis Obispo, over to Kern County and Bakersfield, Lancaster. We have them all the way down the coast, ending up in Oxnard, and all the way down here in East LA and San Gabriel Valley. Santa Maria is one of our newer ones. I want to talk to you, however, about what's going on with our homeless programs and mostly our property here, what we're doing. Developing over 1,200 units of supportive and permanent housing here on the West LA campus, as well as revitalizing the medical center and all the other assets we have on the South Campus for a new enhanced medical center here at Greater Los Angeles Healthcare System. We are not necessarily the largest, we're probably in the top 3 or 4 in the nation, but we are by far the most complex with all of our land use issues, our homeless veteran support programs, and the redevelopment of our South Campus Medical Center.
Wow, That was fascinating. You do have a lot going on for you there. You also have some problems, like every other hospital has, but a little more so because it is a veterans hospital here. You have a homeless problem on your campus there. And I'd like to show people, first of all, the drones. We have a drone video of that. So let's go to that.
So this is a great initiative to help veterans during this COVID period with their own tents or donated tents that we have in storage here that we can give them so that they can survive the COVID period in a clean, safe environment and get all of the care, treatment, and rehabilitative services they need.
It's called Tent City on the Great Lawn there. What's that all about?
So what you're describing is one of those other initiatives that we put forward during the pandemic. It's called the Care, Treatment, and Rehabilitation Services. And the idea there is that we wanted to set up an opportunity on our campus for homeless veterans who weren't ready for big congregate areas for transition to be able to come on with their own tents or donated tents and start a low barrier to entry program to get into transitional housing. It's not been done anywhere else.
Wow.
We're the only place that is doing that.
And you initiated that.
We did.
Good for you.
And we're actually in the process of expanding that now. We've replaced some of the wood platforms that these tents go on with asphalt strips. And we're getting tiny shelters, some people call them tiny homes.
Oh, yes, okay.
To put those on our campus now and have a more hardened, sheltered opportunity for the same thing for our veterans.
About how many are homeless there?
Well, I mean, in Los Angeles, we have almost 4,000 homeless veterans in Los Angeles. We have about 3,000 that are directly related to our catchment area for our healthcare system. And that's been relatively stable for a few years now. So I guess it's not good news to have any homeless veterans.
No, I get it.
The challenge a little bit is that while we've housed 2,000 people on an average basis each year, that many fall back into homelessness, which is why the number's been stable. So we're going to continue to attack that problem with increased vigor.
You are planning to do a lot of permanent housing for our veterans and their families now. So how is that working out?
So you mentioned the master plan earlier. And, and the idea there is to build about 1,200 plus units of permanent supportive housing. These are housing units, apartment-like units in some of our older buildings that are on the campus. Renovate those so that then people who are our veterans who are homeless may use HUD-VASH vouchers. Those are, think of them as supplemental money, if you will, or subsidized money to pay for these units.
We'll find out much more about what's going on in our VA fabulous Greater Los Angeles area here with Dr. Stephen Braverman. We will be right back.
At one time or another, every family is faced with mobility issues for a loved one. Call Before You Fall is here for you with all the safety and mobility solutions your family needs. Come see Alex in the Call Before You Fall showroom, or if you can't, they'll come to you in one of their fully stocked service vans. So put your mind at ease today. Call Alex at 1-800-829-1491. Remember, be on the safe side.
You know, Dr. Braverman, it seems to me that the job that you're doing is one of dedication and commitment, but you also have a passion for it to help our veterans out in every way you can. I see that in the master plan, you're doing a helicopter pad. Now, what would we use that for? Emergencies? I mean...
Well, the helicopter pad we renovated because that was actually part of our fourth mission requirement. So what we mean by that is the basic missions of the VA is healthcare, education, and research.
Okay.
But there's a fourth mission, which is to help the community and the civilian government, if you will,
Okay.
in times of need, such as this pandemic. And we did take patients from private sector hospitals when they were full with COVID,
Right.
and some of them were transported from the Imperial Valley or other areas by helicopter. So we wanted to make sure that we had the capability to receive that in a safe way. So we used some of our CARES money, that was the COVID money that was
Right.
available through the government, to renovate the helicopter pad to be able to serve that fourth mission.
Wow. Now, someone said to me, and I was surprised, you're going to have a metro link by what, next year or the year after?
Right, so when I started talking about the construction
Yes.
earlier on that South Campus, the most visible part right now, just south of Wilshire Boulevard, is a new metro station. It'll be the West LA VA Metro. It'll be the last stop on the Purple Line.
How can people that are just regular like ourselves, how can they help in a program? Are there donations that you can be given, or volunteers that you need from the community?
Sure, we have a volunteer services organization
Great.
within our
Good.
facility, so folks can contact us. We have a website,
And what is your website?
losangelesva.gov.
Okay.
And
We'll have that on the screen so they can
Right.
see that
Okay.
at home.
very good.
I think that is fabulous. And you know what? I am so proud to have had you with us today. I've learned more, especially between the cow vet and the other, that always confused me a little bit. And your master plan sounds wonderful. Your family sounds delightful. You have grandchildren. How many?
I do, 2 grandchildren. Margot is 6 and Ariel is 2.
No, doctor, I have to correct you. One is 6 going on 13. The other is 2 going on 7. I mean, with today, it's completely different. Again, I thank you. Everyone, remember what I said. Pink Lady Presents program with Chaplain Dove and I. We are celebrating, in our way, people who are making a difference in this world, making a difference, not just for their family and themselves, but for other people. And in this case, all our phenomenal veterans, active duty and everything that need the hospital.
And we know, having been involved with the military now for 60 years, that our sister and brother veterans are being taken care of. And sometimes the VA gets a bad rap, but we know better
Right.
because we're involved in it. And I want to thank you again on behalf of all of us who have served and wore the uniform for making sure
Right.
that we get the best possible care. And we believe we are, and we thank you for the leadership.
Thank you very much.
Thank you. And we will see you next